I welcome you to the Healthy Heart, Healthy Life Pune, Session 18, Part C. I'm Dr. Neelkant Karandikar, Senior Cardiologist from Pune, and I'm going to discuss a very interesting topic today. Let me first ask you a question. When are we the best dressed in our life? Yes, I think you have guessed right. It is the time of our marriage. And this is the photograph of a bridal couple, the bridegroom and the bride. But there are several occasions, like going to somebody else's wedding, like going to a party, going to a function, or when you are going to deliver a speech or listen to somebody's speech, etc., etc. So there are several occasions when you really think about what I should wear and am I looking good or not. But do we anytime think about what should we wear when we are going to a doctor for a visit? And especially if the doctor is going to measure our blood pressure. Something we should never do while going to a doctor who is going to measure our blood pressure is to wear a tight dress like this. You can see even the buttons are getting stretched. So a tight dress is not recommended at all. A loose dress is something that you must wear when you're going and visiting a doctor, especially when he's going to measure your blood pressure. Look at the sleeves of this t-shirt. They are very loose. They can be easily rolled up and the BP cuff applied to the arm of the person. And here you can see that the BP cuff has been applied directly to the arm. There is no cloth below the BP cuff. The next thing to remember before going to a doctor who is going to measure your blood pressure, or even if you're going to yourself check your blood pressure at your home with the newly available electronic devices. Second thing to remember is not to have coffee in the previous half an hour. Now you must have realized, ladies and gentlemen, I'm going to talk today about the precautions and the preparation before measuring blood pressure. So the first one was wear loose clothes. Second one, don't take coffee in the previous half an hour before checking the blood pressure. Coffee, 2 cups a day is not bad. In fact, people have shown that it is good for the liver, but that should not be within the half an hour before measurement of blood pressure. Next is the famous chai, probably the most consumed drink in our country is the chai. And this tea also contains caffeine like coffee, which can slightly elevate blood pressure because of its effect on the heart and the contraction of the heart, and therefore should not be consumed within half an hour of taking blood pressure. The next is the cola drinks. There are several cola drinks. I don't want to name them, but they also contain caffeine. Again, these should not be consumed within half an hour of blood pressure measurement. Let me again remind you that blood pressure measurement can be by yourself at your residence using the electronic apparatus, or it can be at the doctor's clinic using either the mercury manometer or the aneroid manometer. Sometimes doctors also use the electronic BP instrument. So the third thing to avoid is the cola drink. And of course, avoid smoking before measurement of blood pressure. And in India, consumption of tobacco half an hour before measurement of blood pressure is also not recommended at all. As far as alcohol is concerned, no alcohol before measurement of blood pressure, because alcohol is a vasodilator and it can affect the blood pressure. No exercise within the previous half an hour of measurement of blood pressure. Exercise, as we know, is good for the heart, but not before blood pressure measurement, right? So this is the next thing that you should avoid. And the last but not the least is, if you are, or if you have gone through a stressful situation, then immediate measurement of blood pressure is not recommended at all. You should be quiet before blood pressure is measured. You should be at peace. So before measurement, do not take tea, coffee, or caffeinated drink within 30 minutes. Do not smoke within 30 minutes. Also, no alcohol consumption. Do not exercise within 30 minutes and do not wear constricting clothes. So these are important things. Sometimes, I have come across cases where every time BP has remained high, finally talking to the patient in detail, well, what have you done in the last half an hour? Have you done exercise? Have you done this? Have you taken cola drink? Have you taken tobacco or tea or coffee? And sometimes the answer is positive, yes, doctor, and then that BP is not reliable. You send the person home, call him back again with clear-cut instructions not to take any of these things before measurement of blood pressure. Also, no stressful situation. And 5 minutes of rest is extremely essential. That will be come across. So first we have seen what to avoid before BP measurement. Now, it is very important to empty your bladder. If you're feeling like passing urine, go and pass urine before BP is measured. Because if you have a strong desire to pass urine and not able to pass it, then that itself is a stressful situation which will raise your sorry blood pressure. So always pass urine, something that you should do before blood pressure measurement. Now, blood pressure can be measured in two positions. What is internationally recommended is the sitting position. Now, see what are the things that you do. First, we said avoid the urine, feel relaxed. In the sitting position, first and foremost is the back should be supported. Back should not be loose hanging. That itself contracts the muscles of the back and your blood pressure may become falsely high. The arm should be bare and supported. Look at this person's arm, bare and supported. Middle of the cuff should be at the heart level. This is the cuff of the BP instrument, and this is somewhere where this person's heart will be. You can see very clearly that the cuff is at the heart level. Lower edge of the cuff, 3 centimeter above the elbow crease. See, here is the elbow crease, somewhere here. And this BP cuff is clearly above the crease. Then some things which the patient should not do while BP is being measured. Ask patient not to talk or move during rest period and between the measurements. The legs should be uncrossed and the feet should be flat on the floor. So this is the ideal way if you are taking or checking the blood pressure in a sitting position. At home, you can use an electronic BP apparatus and take this sitting position and check it yourself. The BP apparatus can be kept somewhere here on the table. Now, blood pressure is many times checked by the doctor in the lying down position. And at least once, at least in my case, whenever a patient comes to me, I check the BP. The first time, at least I like to check the BP, not only in the lying down position, but also in the standing position. Why? This is to check if the person has what is called as a postural hypotension. That means when the person is lying down, the BP is at a certain level, but it abnormally falls down when the person stands. And that can be checked by taking the blood pressure in the lying down position and then in the standing position. Here is a picture which I have just clicked today. One of my patients is lying down. See, this is the cuff of the BP apparatus. The tubes are connecting the cuff to the blood pressure machine. This this sort of cuff is inflated using this bulb, as you can see it here. And when the cuff gets inflated, the mercury column or the electronic indicator rises, and then you slowly release the pressure in the cuff by slowly releasing this valve. And as the blood pressure comes down, we have seen last time that when the Korotkow sounds start, it is the systolic pressure. When the Korotkow sounds stop, it is the diastolic pressure. So this is recording the pressure in the lying down position and then in the standing position. One thing to see very interesting is, my secretary here is holding the blood pressure apparatus at the heart level, and the blood pressure is measured with the BP apparatus at the heart level. This is the most accurate method of measuring the blood pressure in the lying down and then in the standing position. Or you can measure in the sitting position also, but at least once it should be checked in the lying down and standing position to detect postural hypotension if it is occurring. Postural hypotension is defined as an abnormal fall of blood pressure in the standing position. So before measurement, what should you do? Void bladder before measurement. That means you go and pass urine if you're feeling like passing urine. Sit back with your back straight and supported. This is if you're checking your blood pressure in the sitting position. Keep feet flat on the floor, legs uncrossed. Support arm on flat surface at the level of the heart. Take rest for 5 minutes. This is very important. As soon as the person enters the room, sits down, and this thing, don't check the blood pressure. I like to examine the patient, his heart sounds, etc. before I check the blood pressure, allowing time for the person to rest, at least for 5 minutes. Keep mobile phone and other electronic devices away. It is no good on one side if the person is holding the phone on the ear and is talking about something very serious, and you are checking the blood pressure on the other arm. That is not the way to do it. Keep mobile phone and electronic devices away. Now, during measurement, what are the precautions to be taken? Do not talk or move. Do not measure over clothes, which I've already talked about. No constricting clothes. That loose sleeve that we saw can be rolled up and the BP cuff applied to the bare arm. Measure 3 times with 1 minute gaps between measurements. This is many times not done, but at least 2 times is essential. Calculate the average of the readings and store the readings on a log sheet. It is very, very important to maintain a record of your blood pressure with you. And if you have measured it at home, when you go to the doctor, show him that chart. Thank you very much. And today we have seen something which appears simple, but is very, very important. What are the precautions to be taken before measurement of blood pressure? When you get the correct blood pressure, you will get the correct treatment. If the blood pressure measurement is not done correctly, then you will get a wrong readings, and this can misguide the doctor in prescribing the medications. Thank you very much for listening to me during this discourse or talk, and I'm sure you must have subscribed to my channel. If not, please do subscribe, and I'll be very happy with that. Also, give me a thumbs up so that I feel encouraged to bring more and more information to you. Needless to say, like previous times, today's session was in English. Then, after 1 week, it will be in Marathi, and 1 week after that, it will be in 1 week after that, it will be in Hindi. Thank you very much. Again, see you next time.